see, one of the biggest lies that people will tell you in PLAB 2 is that if you fail the diagnosis, don't worry, it's just 1 mark. You can still pass the station. I can tell you that is a freaking lie from the pit of hell. And I'm sorry for my language, but it's because of how passionate this is to me, okay? Hello, everybody. Hello, everybody, and welcome back to my YouTube channel. All right, today's series, we're going to continue with our PLAB 2 series. And here we talk about the common mistakes that people make in PLAB 2. And at this point, I would just like to encourage you to please subscribe to my YouTube channel so that you can keep getting more value content. And please do not forget to like the video. Thank you very much. And if you loved my OSCE segment, if there is any video in particular you want me to make, any scenario that you would want me to talk about the flow of it, just leave me a comment, okay, in the comment section. Thank you. All right. One of the first things is really very poor time management, okay? What do I mean by that? This is really just demonstrating competences in one part of the exam and ignoring the other part. So this would be an example. Somebody would take a history for, let's say, 5-6 minutes. You know, this would not really be good because then you don't really have time to, you know, manage the patients, and you might just rush through the entire management, which will not really be good. So very good time management, and of course everything honestly comes with practice, okay? So everything really does come with practice. So make sure that you are trying to manage your time effectively, okay? I would give you tips on what to do in the data gathering as well, okay? Now, another mistakes as well for PLAB 2 would be really ignoring the patient's concern, okay? So, for example, a patient has a concern, but you know, you've studied in maybe your academy or with your friends, and in your mind, you're thinking, okay, this is how the scenario should go. And all of a sudden, the patient is saying something new and something different from what you're used to. And you're like, bro, I don't really care, whatever. I'm just going to, you know, the way the scenario is playing in my head, this is how we are going to do it. And honestly, that will not do you well, okay? So one thing I always say is, use those materials as a study guide, but on the exam day, please, keep an open mind, okay? On the exam day, keep an open mind, okay? Just keep an open mind. Sorry. This is very important to me, and I say this because this also happened to me, okay? Of course, the details cannot be discussed, but I know what I'm talking about. And I'm sure that, and I'm very sure I'm not the only one who does that, okay? So keep an open mind about the station, okay? The station might not be as you are used to. And again, when you practice, just practice with the structure. Don't practice like, okay, I'm going to get this exact same scenario in exam. Don't do that to yourself. Just know the things to look, especially your ethical stations. They can change. The issues can change. And you really have to pay attention. Maybe medical stations, I mean, because if you think about it, chest pain plus fever plus cough, a cough that is greenish is always going to be pneumonia. That's a given. Yes. But for your ethical and counseling stations, please do keep an open mind. Medical station, they would never change. A patient that has a stabbing pain in the face, okay? Pain is triggered by taking something cold or during cold weather. There is no numbness, no weakness, no trauma, okay? I mean, the pain feels like an electric shock-like pain. It's never going to change. It's classic textbook. And of course, there will always be trigeminal neuralgia. And that's a given, okay? But the patient might have a different concern. The concern to them may not even be the pain. The concern to them might be the adverse effect of the new medication you're going to give them. So please do keep an open mind. This is really, really, really important. Do not ignore your patient's concern, and do not go to that exam without asking your patient, do you have any concern for me? What worries you the most today? Is there anything you think I could possibly help you with today? You need to ask the patient those questions, okay? All right. Okay, so you really need to do interact and ask your patient their biggest concern today, okay? Yes, another reason, which is the very obvious reason, to be honest, which I think a lot of people feel as well, is inadequate clinical knowledge, okay? And why do I say this? You just really, when you go to the exam, you really just don't know what a diagnosis is. Like, they've given you all the symptoms and you're just like, bro, I've never heard this before. I don't know. To go there and say, I don't know. So what do? You kind of just make up a diagnosis, hoping that somehow that diagnosis will be the right one. But of course, you have to remember, if you give a patient a wrong diagnosis, you are likely not to pass the station. Because the way I think about it is that, think about it really seriously and truly. If a patient walks in here today, okay, and the patient say, maybe I may be exaggerating, but anyways, it's just for the sake of learning. So let's example, you took a history from your patient, you collect the patient, and patient has a sinusitis. But guess what? You're like, oh, after speaking to you and examining you, I just suspect you have, let's say, a migraine. Okay, I'll give you some painkillers. And of course, the painkillers definitely will help with sinusitis, okay? And really, if you think about it, a lot of times sinusitis is self-limiting. But in reality, ask yourself, if you give a wrong patient, if you give in real life, if you give a patient a wrong diagnosis, do you think anybody will applaud you? Do you think they'll be like, oh my God, your Socrates was awesome, your Odipara was good, you did all the Maphtosa. Now, you did all of those things, but the information you got, you couldn't use it to make a good clinical diagnosis. So, of course, you're not going to pass. See, one of the biggest lies that people will tell you in PLAB 2 is that if you fail the diagnosis, don't worry, it's just one mark. You can still pass the station. I can tell you that is a freaking lie from the pit of hell. And I'm sorry for my language, but it's because of how passionate this is to me, okay? It is actually a lie, like the biggest lie you would ever hear, okay? You need to know your cases, period. But that doesn't mean that if you don't know it, you will fail it. And let me tell you why I say that. Now, if you really don't know it, give your differentials, and that's okay. But what you cannot do is to look somebody with your full chest. For my Nigerian people, you understand that language, that slang, with your full chest. What you cannot do is to look at somebody that has sinusitis and say, oh, you know, because you mentioned you have this headache and blah, 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 I think that you have tension headache or you have a migraine. You cannot do that. But what you can do is, okay, after speaking to you, a few things are running through my mind about what could be possibly causing the symptoms that you have. One of them, I think, is this. One of them, I think, is that. And that's okay. That's fair enough. But you really have to think like this is a real patient. Okay, don't think like this is an exam. It's a real role play. I want you to think of these people as real people. So if you give a patient a wrong diagnosis, that's not good enough, doctor. That is not good enough, okay? So that's something, and I know I've probably talked about this a lot, but it's because it's very, like, this is really important to me. And I say this because I had stations where I gave the wrong diagnosis. And of course, you know, in management, they're going to give you all 0, 0, 0, because they're like, bro, I'm playing with you. Like, I'm not even going to give you marks to boost your overall marks so that you can get the cutoff. Like, we're just going to give you a 0, and that's on period, okay? So this is really, really important. Make sure you know your cases. So inadequate clinical knowledge is really another reason why people fail. Go and check people's results. Like, when you see people post results on social media, even those that fail, look at it. They do well in data gathering. They do okay in IPS, but guess where they suck? Clinical management. Management is where it sucks, okay? So that's where it sucks, okay? It's the management. So please make sure that you're familiar with your cases. Make sure you know the common cases, okay, that will likely show up on an OSCE examination, okay? And finally, for me today, another common mistake that people fail PLAB 2, I do think, is nervousness and anxiety. And to be honest, this is really, really painful because you've put in the months, the weeks of hard work. You have practiced day in, day out. You have done your best. But on exam day, you allow your biggest enemy take over. Don't do that. Let me tell you, for OSCEs, your biggest enemy is your anxiety. Your biggest enemy in PLAB 2 exam is anxiety. And I say this because I teach in medical school and we do OSCEs for our students. And I have seen the brightest of the brightest. Like, of course, because you teach them in the classroom, you do know them. You do know that this student knows their stuff. This student is good. But guess what? When it's time to perform the clinical skills, the student is so nervous, they are so anxious, and they're just all over the place and doing the wrong thing. And because you know them, you can actually say, you know what? Why don't you just calm down for a minute and restart and continue from where you stopped? But the way I think about it, and the way that was really important for me in my exam, when I go for OSCE, to be honest, PLAB is not the first OSCE I've ever written in my life. It's actually going to be the 4th OSCE exam. When I say 4th OSCE, meaning that external OSCE exam where like nobody knows me and I just have to demonstrate that, hey, please, I'm good, help me, pass me. You know, so one thing I tell myself for OSCE is that, Esther, these people don't know you. Esther, you are good, but if you cannot demonstrate that today, nobody's going to know that. Okay? And that helps me to keep my anxiety in check. And I want you to do the same. You can keep your anxiety in check. There is no need to be anxious. You are an amazing doctor. You've gone through years of medical school. Some of you are specialist trainings right now. Some of you are registrars. Some of you are senior house officers. Some of you have even been consultants, but because you want to, maybe for whatever reason, you want to move to the UK. So there is no need to be anxious. There is really no need to be anxious. If you can demonstrate what they are looking for, I can guarantee you, you will pass the exam. And I say this because in at least 8 stations, my scores range from 10 to 12. So there are definitely things that they are looking for, but you have to demonstrate that. And if you're anxious, that is not going to help you. Okay, anxiety is your worst enemy. When I say anxiety is your worst enemy, for me, I do like the adrenaline, meaning that I like the, okay, oh, I'm having an exam, you know, the adrenaline a little bit. I like it because it keeps me in check, and also the fact that, Esther, if you don't do well, you are likely to fail. So that I'm also not on the extreme end where I'm so relaxed. I'm just like, oh my God, I've just passed this exam. I can never fail it. I'm very good. You know, I know my stuff. No, don't do that. You can be on the extreme as well. Okay. So just find a balance between, but what I'm saying is that do not let your anxiety get the best of you. And one of the ways you can also reduce anxiety is really by preparing effectively and preparing well. And on this note, I'm going to say that the truth is, for many people taking PLAB 2, you're in different parts, you're in different aspects of your life, in different chapters of your life. Some people taking PLAB 2 are people that are recent graduates, who are house officers or senior house officers. So some of them have that, you know, clinical knowledge. Even if they get a similarly like new case or something they're not familiar with, they can, you know, use their knowledge. You know, they can just pretend like, okay, this is a patient I'm seeing in a clinic. Okay, what will I do here? But the truth is that there are some people as well. You are a consultant, maybe in a field of even ophthalmology. So you don't get to see a lot of these things. Give yourself time. Give yourself time. There is no need to rush it. Maybe your friend that wrote it within 2 months or 3 months. Maybe this your friend really just has a lot of time. Maybe your friend is in a less busy specialty on the hospital where, okay, they only do 8 to 4. Then afterwards they can go home and practice for 3-4 hours. Okay, so give yourself time. Don't see on this journey for PLAB 2. As far as I'm concerned, there is no timeline to accomplish anything. Okay, yes, I know we still set timelines for ourselves. Don't take it out of context. What I mean is that don't rush it. Don't rush it. Don't rush the exam. Give yourself time. All right, so what I'm saying is, in essence, just take your time, okay? We are different phases. You might be another one. Maybe you've not even done medicine in, like, for example, like me, I've not done medicine in 8 years. Yes, however, yes, I've been teaching in medical school, but teaching since it's your trophoblast, okay, and Mendelian inheritance is very different from managing, you know, emergency cases, okay? So it's just acknowledging that you're different phases of your life. So don't rush it. You know, don't rush the exam, honestly. Like, there's really no need to rush it. Be ready, be prepared. And I will give you other tips as well that you can do to pass the examination. Okay. All right. Thank you so much for, you know, staying with me here today on today's episodes of Common Mistakes for PLAB 2. Right.